Hello, everybody. Welcome to another episode of AV's Maxillofacial and Dental Talk. And in today's episode, we have Dr. Rahul Tiwari. And sir, can you please give a short intro about yourself as to how you started from scratch and what you're doing currently? Because this is something what is known as scientific writing, if I may term it correctly, especially for medical or anyone with a doctor prefix, as sir used to tell. So all yours, sir.
Thanks, Vinay, for having a short time and inviting me for this small talk. I am really very happy to share whatever about my expertise in this. So, hello guys, whoever is listening. I am very fortunate to that you all are present for listening me. And my name is Dr. Rahul Tiwari, and I am a maxillofacial surgeon and a dentist, obviously. So my schooling and all has happened from Kondagaon, that comes in Bastar in Chhattisgarh, and then I have completed my UG from Maharashtra and from Pabni College, and then PG from Guntur College. Then I completed my fellowship of AMSI, in which I secured All India Rank 1, and I did it from Jubilee Mission Medical College, Thrissur, where I've done my fellowship in orthodontic surgery, where I've learned craniofacial. And then I have worked in Hyderabad in FMS hospitals, and I was an assistant professor is SSDCS Vikarabad. And right now, since past 3 years, I am working in Vishakhapatnam for different corporate hospitals. I am also attached as an associate professor in one dental college. So basically, when I was in my postgraduate time, that time I started, we used to have a lot of research publications, as you know, in thesis, dissertation, writing an articles, case report, research review. So from that time, I developed my interest in this academic writing or medical writing or scientific writing, whatever you can say. It all deserves the same only in and out true. So there I started this, and slowly what happens is like I had so many people who need the help of writing. See, what my concept is, we are very busy in our whole schedule of our postgraduate, or you are in a college or in medical college or dental college or any health science field. We will be busy with treating patients, and our curriculum doesn't teach how to write, do a proper research, how to write an article, how to do a publication of it. So somewhere this is a lagging point. There is a gap in the curriculum or in the infrastructure of our whole medical and dental curriculum. So who will fulfill that gap? There is complete need of medical writer or scientific writer or proper agencies who should help in this medical writing and publications. So from there it started, because every time we used to know, whenever it comes to about research article and writing, we don't know where to start and where to end up with. Still now there are so many postgraduates or even in the staff, they are always in confusion about this. So from there, this writing and publications started. And then I used to write, then I started acquiring or hiring more writers or more people who will help, who has the knowledge of this writing and publication. So what we do basically is we will help, it is a service oriented company where we help in completion of thesis or dissertation or medical or article writing, like research, case reports, systematic review, meta-analysis or bibliometric analysis. And then we help them to publish it around. So it is just like helping them in some or the other way, so that all the barriers which they come across should be completely removed, and they can have an easygoing medical writing and their publications of their various thesis, dissertation, or articles. So in this, how it comes is like now in the starting phase, it's like there will be so many students or staff who will be knowing how the things happen. But in some places there will be one stop that, sir, how to proceed this. So from that level we will help them. If somebody is not doing anything, then from starting till the end we will help them out.
Okay. Okay.
So this is how writing and
Yeah,
publication things
sorry
is.
to interrupt you, sir. You had a very, very valid point here. Like, we are not taught as to how to write. Although there are many institutions which encourage the students to publish, but somehow the art of scientific writing is not discussed much. That's a very, very valid point.
Correct.
The first thing. And now I have a
Yes.
few doubts. Like, say, assuming like I am a student, okay. So say I'm an undergrad student or an intern, and I want to publish something, and you are going to help me in the scientific writing, right? So the first thing which comes to my mind is that, like, how do you decide, like, how to ensure that it is published in a quality journal, right? Because the quality of the journal or the indexing of the journal matters a lot. As I'm sure people who are into scientific writing will understand this better. That is one thing. And of course, all these years, ever since the time of the early medicine, it has always been whatever is documented, which has changed the way people practice whatever we are doing today. So, documentation is very important. And I think you've been doing a wonderful job here, sir. So, yeah, that's what I wanted to say here. So, one thing. And the second thing is like, this just randomly came to me is I'm giving it to a third person. Like, I know you personally, sir, Dr. Rahul Tiwari. Like, I'm still giving my work to a third person. What are the chances that there are some people who might, take the work and use their names to publish, and whoever has done the actual scientific work behind it might not get recognized? Like, so any ways to avoid it, or you understand what I'm trying to say here?
Yeah, thanks for the appreciation first, Vinay. And second thing is, yeah, there are two, 3 points which you have told. The concept comes out like we will be very busy in our surgery parts and all. So if the whole day we are busy in our cases, when is the time that you can put your effort for this writing? So there is a time lag also. So
Correct.
for that reason, what will we hire a person who will help you out? Now, second comes about the ingenuity of the journal. So, see, our NMC, National Medical Council criteria, National Dental Council criteria, are all over the world. When it comes to indexation, PubMed and Scopus are the highest level indexation, which is valid everywhere in the world. Then comes about the Web of Science, which is valid for Dental Council of India. If you go for Saudi or Malaysia, they ask for Science Citation Index. Then in some countries of European countries, they will ask for mostly PubMed only. In UK and US, they will ask more of PubMed Scopus. So depends on the places also it matters. But yeah, PubMed Scopus are the highest. Then comes about Web of Science according to the National Dental Council. And then comes your SCI or ESIC, which comes from different countries which are valid there. And then in National Medical Council, there is MBASE and DOJ index. These are also there. And the basic index called as Copernicus is also, which was valid before, but right now it doesn't have much validation. Other than this, also there are so many different index, but they doesn't carry certain value. Now it comes to whether the journal is authentic or not. We should never ever believe what journal website is showing. If you see 1 lakh journal, there will be more than 67,000 journals which shows different index, but they are not valid index. So for example, if you are going to search a journal, whether it is PubMed or not, we should go to the PubMed or NCBI website, and then we have to type the journal name, and then we have to see. In that also, we have to see when, till when, from starting from when till when it is under this. Because there are
Okay.
so many journals. If you apply for PubMed, no, obviously in PubMed, the journal name will be seen, but you have to see whether which is valid from which year to which year.
Correct.
If you
Correct.
are seeing that the name is there in PubMed, but down the validation is showing from 2009 till 2022 only, that means as of today, if you publish, it will not going to show in the indexing database. Even though the journal will show your article in his journal after publication, but it will not be shown in the database of the PubMed. Same way, if you want to see for PubMed, Scopus, you have to go for a Scopus website. If you want to go see for a Embase, you have to go for Elsevier and download the articles of Embase, which is present right now. Every month it gets updated. Then if you want to go for Web of Science, then you have to go for Web of Science or Thomson Reuters, or there is MGL Clavaret Analytics. There you will be finding the authentic journal. So you have to see the indexing of the journal in the indexing website rather than believing on the journal website. This is your second point.
Okay.
And third, which you are asking about whether you have given a data to someone and then they can obviously misutilize it. So there is something called as copyright form. So
Okay.
legally, if you have filled up copyright form, you have submitted it to the journal. So you will be coming to know, and somebody publish your data, and the data is yours because you'll be having an ethical clearance committee from your institutions. You can directly, you have the data, you have done your study, you can directly go legally if something happens. But obviously, if you go for example, in my company in writing and publication, most of the people are authentic writers who are already professors from different colleges who are working with us, proper statistician, proper data team analysis people. So everything goes in a proper way and from, because for every each and every person, and they all are already working somewhere. So it is about a long term benefit, and it is not a short term. There are so many research. We also do different research activities. So it's not about having just a name in one article, but the authenticity goes away. So it is preferable that you get it done from an authentic company, or the medical writing business is a very huge, it's a $1 billion company in the whole world. There are so many websites who are doing so. So it is
Mhm.
important to go for an authentic company who is doing a work, or it is better to go via a known one. For example, we are doctors, we know that we are also doctors, we are from same fraternity. So most of people get the work done. It never happens that we will be doing all sort of quack businesses.
Okay.
And it is also there ki, I remember that I started this from like India. I had hardly 5 or 6 clients in starting from 2017 or 18. So today we have more than 3 to 4 thousand clients from different 7 countries who are
Wow.
getting the work done,
Amazing.
taking the
Amazing.
help services from us.
Great exponential growth, actually. It's fantastic. So,
Thank
but one offbeat question is I've also done my fellowship in oncology and, as a maxillofacial surgeon. Now, if you're totally into scientific writing, don't you miss being in the OT or you get time for that also? Or,
No, देखो, I run this company as a part time, not a full time. I am
okay,
consultant to 3 to 4 multi-specialty hospitals. So
amazing.
obviously my day timing from 11 to 8 goes with surgery only, and after morning it's like morning 8 to 10:30 is the time where I take meetings for writing publication, and again at night from 9 to 12 we sit with our clients or our writers to have that meeting. So there are people who are doing work for under our company. So obviously it needs time. You have to give time for something. It's like that.
An inspiring journey. And in fact, for all those people who are watching, you need to understand be it any profession or any business, you need the patience, perseverance, and sincerity. It will grow one day, and you need to keep putting in your right efforts there. And one such example is Dr. Rahul Tiwari, who is present right in front of me. So, anything or any
Thank
other tips you would like to give for scientific writing? Because even people, there are postgraduates who have to do their thesis or LD, and they face a difficult time. Apart from what has to be sent to the journal for publishing, they have to get their thesis or LD approved there. So, any tips with respect to that? Something you can give from your side?
Yeah, the thing is ki obviously in a busy running medical colleges, dental colleges, the PGs won't get time to complete that PGs because they will be full day busy with the surgeries and cases. And even the staff will be busy. So it's very difficult to find a time. They have to sit with the staff and then we have to discuss about all those things. So it is always preferable that first and foremost priority is your staff, who is your guide, co-guide, or the assistant and associate professors who are available in the college because they have the knowledge about the scientific writing and publication. That's why they are in that post. So first and foremost, you take the help of them because they know in and out of your research projects what you're going on. And even that after that, if you find that there is some time lag, you can always take help from such companies who will be always there to help you. So that is one thing. And then when it comes about the selection of the journal, putting up that, there are always, if your staff, first and foremost, for everything, your staff is there. They will be guiding you, okay, you can go for this journal, that journal. And when you select a journal, also see that which type of titles are publishing in a journal, or what is the acceptance rate of a journal, or for example in how many issues they have. For example, if you are in your second year of your PG, now you want to publish an article, you see there is a journal who is publishing half yearly only, and their review time is almost 6 months, and you
Hmm.
see that the acceptance rate is 20%. So putting your article in that journal might be a little questionable because 6 months will go for review. After that, it gets accepted. Your third year is gone. After that issue only it will publish because there will be PDF proofing of the article. So many reviews will happen, acceptance and PDF proofing, corrections, grammatical, spelling. So many things are there. So obviously you find a journal which is at least quarterly, or acceptance rate is preferably be more. Because ऐसा नहीं कि in sub association journals or some journals which are there in good index like PubMed Scopus, they might have quarterly issues, bi-monthly issues also. They might be charging more also compared to the free journals which are there, because everybody want to get it done in free journals like that. So according to your budget and according to all those things, you can go through and select for those things. If your staff helps, well and good. If not, we are always there to help them out in that manner.
Correct.
And when it comes for thesis dissertation in college, you will be getting proper statistician, proper data collection you will be doing. So you can always take a help of a statistician to get the statistics, because we are not taught how to do a proper statistics. We don't know how to use SPSS software also. So you can always take from community side help, whether it is medicine or dentist, you are doing stats, and they can give you proper inferences and results. Then you can sit and do all that collaboration work with them or discussion, and then you can frame the whole thesis or the dissertation. And if somewhere if you get stuck up, we are always there to help in that manner.
And what about LD, sir? Library dissertation.
Library dissertation is also the same, because thesis is something where you are doing a research, but library dissertation is a proper systematic review which we can tell. Suppose you have a small topic, in that topic from starting in the history till the end of till date today, whatever things has published, you are combining that topic in a form of a book. That is what is called as dissertation. So
Mhm.
there also, if you find difficulty topic selection or finding the reference articles in some or the other manner, or making a proper review, or some haphazard you have in discussing all those things, or making a proper systematic review, we do help for that.
That's
For
nice.
all the type of thesis related work, dissertation related work, or article writing, journal finding, journal publication, everything in writing and publications, we do help. That's why we term it as a one-stop solution for all the medical writing and publications for medical, dental, and health sciences from starting
Health
till the
sciences,
end. That
yeah.
is what we quote always.
I think that's a very important point to note for all the viewers. It's not rest, although we are from a dental based channel, the Surge business is for almost all scientific writing, be it medical, dental, or allied health sciences also. So they are more than happy to help here. So, um, how you told me like this is like $1 million business and all that, no, so how do you ensure the plagiarism or those things and all come down a little and it's not overlapped, or there are we can see a lot of people using the same content, just changing the titles and giving it to different journals and all that. So how do you avoid such things or do not become a part of such practices?
Yes. Very, very well, very, very valid question, I should say, because plagiarism is a very important criteria which should not be there. The authentic journals will never accept those articles which are having plagiarism. So there is something called as Turnitin or Authenticate software, where you can just, it is a paid software basically. You have to upload the article there, and then it will show from which all plagiarisms are there, from where you have taken the plagiarized content and then use. So we take that subscription of that Authenticate and Turnitin plat software, and we use that for our work, so that the work whichever whoever is taking should be authenticate and should be helpful. My we always feel ki whatever work is done should be proper, and it should help the person for a lifetime. That is what it makes sense. Otherwise, just doing that part of work just for time being doesn't make sense. If you have published an article in a journal, it is in your name for the whole years or lifetime. Unless and until this world is there, your name will be there whether you are not there. So
Correct.
it's like that. So that much importance and article publication takes. And you have, if you have done a good work and you have published this, obviously, if you have done a study and you don't publish it, it is just a piece of paper. It's not going to make a sense. How people will know that you have done something? So when you publish it tomorrow, the same type of articles all over the world, whoever is doing a study, they will cite your article. They will take a reference of your article and they will perform the studies in a higher level. So authenticity of an article writing is very important. So for that, we will use plagiarism softwares. And I always believe that rather than doing something copy paste work from the starting when you are writing, no, don't copy the things. For example, if you have a title and you have downloaded 10 articles out of that, read those 10 abstract and articles, read the introduction part, read the result, material, method, discussion. According to that, whatever as per your feasibility, you can do your study. And then you can, when you are writing up an article, if you have an introduction, you're writing an introduction, read those 10 to 15 articles. Whatever you are grasping from that, write it in your own words. That is what is important. It is not like just copying first paragraph from one article and citing that, second paragraph from another article citing that. That is not a type of article writing. So those things we always take care with our writers, because those are professional writers who are working. So these type of things will never happen, that copy paste part. So
Okay.
we'll always have that. We will they will read the articles and they will properly format the articles, and whenever we do some work, we will always check multiple times. For example, PubMed and Scopus, if you go, they will take only below 10% below plagiarism. Some journal might take 5 to 3% also, because there will be some technical terms which you cannot change, like
Correct.
alpha hydroxyapatite. You have to tell alpha hydroxyapatite only. You cannot name it differently. A
Mm.
maxillofacial will be called as maxillofacial only. So those things obviously do catch plagiarism. That's why there is a range like 3 to 5 to 10%, which journals accept. So we will always give an authenticate plagiarized report also to the clients.
Okay. So, if say if I have collected data for my thesis and I give it to you, you will do the writing as well as the statistics part for me also, right? So you have the team
Yes,
which
we
will.
Yes, correct. First and foremost, we will not directly write it. We will always, if they need help with a statistician, we will ask them, do you have any statistician somewhere, or the charges what a statistician takes, we will offer them. If they're fine, then they will get the stats. Then we will teach them, how do you write an article, how you do. It's not about, I don't believe in giving just a cut, make a cake and just give them to feed it. They should learn. That is what is important. That's why it's a service oriented company. They should learn how to do the work. So we will teach them also how the things are done. And in that doing, when they have some difficulties, then we will help them that part.
Okay.
In some cases, there will be chances that they don't have time, they are in urgency, or they need that help from complete. Then according to the situation, we do help them.
Mm-hmm. It's nice, sir. So I would be happy if I'm okay to share your email ID and contact details at the end of the interview, so that people will be more than happy to contact you and take your help to, do their respective scientific writing and make sure they reach higher places and all. Because these days, one of the primary requirements, whether you're going to go to join an institute to become a senior lecturer, or climb the ladder to become, associate, assistant, or go abroad, everything requires publications and scientific work, right? So it requires a lot of work
Yes.
here.
Nowadays, even in India, also for government jobs, also the recruitments, they are asking publications, because in National Medical Council, what they have come is like there are 4 parallels. In that second parallel, they have made it at research. So in Ayurveda also they have come, and obviously NDC will be coming up with that the same concept. So research, if you want in jobs in India or in abroad, anywhere, publications are of high value. The students who are going for DDS or in higher education abroad also, they are also in universities will do ask publications. So it is very important nowadays. Without publication, getting jobs in health sciences, unless you are just in a corporate setup, it becomes difficult. So it is good to have.
Okay, so one last question. This is like, okay, see, there is no ideal way of doing something, right? There's always a gray line between anything. So I know a lot of doctors
Correct.
uh, who are totally out of academics. So once they finish their post graduation, they're completely into private practice. So they don't go to any form of institutional practice itself. So basically, they're keeping themselves away from these publications. Are they missing something, or if they, kind of they are practicing at the same time, they refer a couple of journals, just, by just reading, you're not contributing anything, but you're just reading anything. So are they missing by not publishing over the period of their career as a doctor or a medical practitioner? Just a curious question.
Yes. No, evidence-based practice is very important nowadays, Vinay. If
Okay.
suppose I am doing a
Absolutely.
case of
Yeah.
some I need to see, I cannot follow the old books all the time. There are so many advances which are going. And how do you know about advances? Books are published 5 years old. They are just upgrading. But research articles are those which are upgrading day by day. Every time, every second, there are multiple research articles publishing in the world. So find an authentic journal. Obviously, read those types of. That is what we do in our PG times also. So
Correct.
when you come into corporate things also, I always tell even the corporates, even we are into corporate setups now, we are working. So if anything we feel that it is rare, we must get it published. Even though I always tell my corporate friends who are there, if they are from any medical or dental backgrounds, if you find a case, if you're not able to get it published, you just give me the case, I will get it written and I will publish it for you.
Very true.
Because in an article have maximum authorships, there can be 1 author, 2 author, 5 authors. The person who has done a statistics part, person who has done a data collection part, person who has done a case, who has reviewed it, who has edited it, who has written, everybody can have a name in the article. So it's a collaborative work. So at least if somebody has done a case, he cannot write, we can get it written and published. At least literature may, that will give a essence to the literature. Tomorrow, if somebody is doing such a case, he can take a reference and it will be benefit. At least if suppose you know that these things should not be done and these things can be done, at least that person will not try those things which should not be done in a case. So
Absolutely.
evidence-based practice is very important nowadays. You have a lot of evidence. So any evidence, if you have no, you must get it published.
I still remember my professor's words during my postgraduate days. There is no good journal, there is no bad journal. It's all a perspective, right? It's like how you see it
Yes,
and how you take it. So thank
correct,
you
correct.
so much for your
Not
valuable.
necessarily that.
Yeah. Please.
Yeah, yeah.
Is there
I'm telling
something
it's
you'd
not
like to
necessarily
add on, sir?
that.
Is there something which I didn't ask, or you want to share with the viewers? Something from my which you feel I've missed, or something you can please add a
And
few more lines.
Absolutely. And that's what you told that point, valid point, Vinay, your professor tell. I also tell, it's not necessary that if you have done a small case, which is not very big, don't go for higher end journals, but there are small journals also which will publish. No, publish in that. At least you are giving some evidence to the literature.
Correct.
And nowadays, one thing I would like to add, medical writing is a huge, not only business, but it's a huge job offering nowadays. I can tell there are some of my writers who might be earning 10, 20,000 per month. And there are some level of writers who are earning 1 lakh, 1.5 lakh, 2 lakhs also per month,
Okay.
who are very senior level writers.
Wow.
So this is also a growing thing because people need, it's the need of the time, need of the hour.
Amazing,
It's
sir.
like demand and supply, what you say.
So so if you're watching the video, if you've completed your dental or you've done any part of medical sciences, and somehow you personally feel you're not good with this, but if you're good with your writing skills or something like that, I think this is a wonderful job opportunity, like scientific writing. And thank you so much
Yes.
for your valuable time. And I'll share Sir's contact, email, and phone number so you can reach out to him not only for job opportunities, but also if you want to get your article published or if you need some help with respect to scientific writing, be it any dental, medical, or allied health sciences. So thank you so much, sir, for valuable time. It was a pleasure talking to you.
Same here, Vinay. Thanks for your time too, and thanks for calling me here. It's really thankful. And all the listeners, thank you so much.
Yes, sir. Thank you, sir.